Good morning, everyone. It is April 5th, 2022. We'll call the Wright County Board of Commissioners meeting to order. Please rise for the Pledge of Allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right. Well, good to see everybody here. We've got a room full of special guests. All of you are. So the first order of business, the minutes from last week, 3/29. Anyone have any questions?
I'll make a motion for the minutes from March 29th, 22.
All right.
I'll second
Motion
that.
made by Commissioner Delyden, seconded by Commissioner Vetch. Any discussion? Hearing none, all in favor?
Aye.
Opposed? Motion carries. The approval of the agenda. Does anyone have anything to add or subtract? I haven't heard from anyone.
I'll make a motion to approve the agenda.
All right, motion made by Commissioner Delyden,
I'll second.
seconded by Commissioner Ketchmark. Discussion? Hearing none, all in favor?
Aye.
Okay, motion carries. Consent agenda. Anything anyone would like to remove for further discussion?
I'll make a motion to approve the consent agenda.
All right, motion made by Commissioner Delyden,
Second.
seconded by Commissioner Wetter. Discussion? Hearing none, all in favor?
Aye.
Motion carries. All right. Wow, we are at 9:02, and we have Mr. Steve Job, our surveyor, here with a resolution.
Thank you. Good morning, Madam Chair, members of the board. I'm here with members of the Public Works Safety Committee, along with representatives from the three departments of Highway, Parks and Recreation, and Surveyor. We're here to request that the Wright County Board of Commissioners recognize April 11 through 15, 2022 as National Work Zone Awareness Week in Wright County. We support this public awareness campaign for all work zones, including county highways, parks and trails, and any other county facilities. Included in your board packet is a resolution for your consideration.
All right.
You
We had a
Want
chance to,
want me to read that? I
you
can.
know what? That would be great.
Yeah, I
Otherwise,
think-
one of us could, but go ahead.
And we do plan, it is for next week, and we do plan to do some public awareness campaign. John Holler's in the room here, and just kind of get some things out there. The more we can do, the better, I think, for
Yes.
all of us that are standing out there in the work zone. So whereas National Work Zone Awareness Week is an annual spring campaign held at the start of construction season to encourage safe driving through streets, roads, and highway work zones. And whereas National Work Zone Awareness Week is a way to raise public awareness for work zones and those who work in them, and that motorists are encouraged to slow to posted speed limits, eliminate distractions while driving, and be watchful for roadway workers, their equipment, and vehicles on the side of the road in work zones. And whereas the theme for the 2022 National Work Zone Awareness Week is Work Zones Are a Sign to Slow Down. If that was up there, it'd be great. Beautiful. We will put that out there on the website. And whereas solutions to keeping everyone safe in work zones and on our roadways is our collective responsibility. And now, therefore, be it resolved that we, you, the Wright County Board of Commissioners, do hereby acknowledge the week of April 11 through 15, 2022 as National Work Zone Awareness Week in Wright County. So, thank you. And then we ask that you adopt this resolution.
Madam Chair, I'll make a motion proclaiming April 11th through the 15th National Work Zone Awareness Week in Wright County.
All right.
I'll
Motion made by Commissioner Vetch, seconded by Commissioner Delyden. Is there any discussion?
Madam Chair?
Yes.
Just a couple comments. I think that this could apply to every week because people should be doing this, every day whenever they see you folks. And on another note, some of you here, by the looks of your vests, make a better case for safety awareness than others.
Mine is fresh and clean, and price tag's on the back. I'm going to return it. No, I'm just kidding. You can tell who the workers are and who the supervisors are.
Yeah.
Virgil, you
like
could
there's
use
a
a
lot-
little road dust on your vest too.
Looks like there's a lot of supervisors, only one worker.
Well, that is the one thing we talk about in the safety committee. It's about keeping things fresh and clean. And even the cones, you know, they get ran over, they're scarred, and oil and dirt and everything get on them. So that's part of our job, is keep an eye on that stuff for the county and try to get it as safe as possible. And hopefully, we all drive, right? Everybody out there, we all drive. It's just a matter of slowing down and being aware and attentive. So,
You know, one thing you could do next week is to put those cones at the DMV, at the county. You know, kind of have a cones with in the highway, on the sidewalk.
and direct them.
Yeah, with a little sign saying why.
Yeah. Yeah, everyone's coming to get their license renewed. They're all driving.
Yep.
Yep.
And some are new drivers.
Correct. Yep.
And then you could throw one in the middle and see if it confuses them.
They do get ran over. We all know that.
Oh, yeah.
We go to pick them up and they get crushed. So, and if the truck drivers with the dualies in the back can hit it just right, they sometimes take them down the road a ways. They get wedged in the middle.
Yeah.
Once you go ahead and do what you're going to do here, then we'd like a photo an op if you would.
Yeah, and I was just going to say that speed in general was the leading cause of fatal crashes in 2021. So it's, you know, when you look at 162 speed-related deaths, that's, you know, people just need to, in general, you know, slow down, but particularly when they see road crews or emergency vehicles or anything, you know, move over, slow down, do what you need to do to keep everybody safe. So,
Yep. That's right.
thank you.
Thank you.
All right, any other comments? If not, roll call vote. Commissioner Ketchmark?
Aye.
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 Aye. Aye.
Resolution passes 5-0.
Thank you.
And you'd like to get,
Could we do that now and then we could get back out there? It's up to you guys, but
Yeah, that's fine.
Yep.
I would
Yep.
think
yeah, as
so.
long as we're all here.
we got a few minutes, Captain?
Just come on here and John will take a photo of this.
Come on, guys, don't be ashamed.
That's
Beautiful.
You want us here too, Steve?
You want us to
with you?
stand behind them?
yeah, if you can see between, that's fine.
Okay. Yeah, that way we don't have to. That- That way, since I'm so short, they'll see me.
That's all right if they don't see me.
Slide in. There you go.
Slide in. You're good. You're good.
I'll straddle the here.
Tell people in front.
Yep. Yeah, where do you come from? All right. Captain O'Malley.
Morning, Madam Chair, Commissioners. So, back in January, we came to you with a request to move forward with coming up with a contract with Centricare, to provide us with jail medical services. You should have a copy of the contract. I just passed out a minute ago a little bit of a comparison of hours and things. So when we started talking with Centricare, it was probably late summer, early fall of last year. When that proposal first came out that we used to present with you, that was actually back in September of 21 that we came up with that. At the time, it was obviously just a proposal, and the numbers that we were using were, I believe, about 130 was our ADP at the time. And that was a proposal that they put together for us to be able to make a presentation to the board. Since then, our population has gone up a little bit. This contract is based on an ADP of 150 with a 10% swing in there, so that if the population changes by 10% for more than 6 months, up or down, we can talk to them about making adjustments up or down depending on our needs at the time. Also written into this contract is a routine reassessment of the needs of the population, and then potentially taking a look at where those needs lie and how are we going to address them. So there is a difference in the number from what we proposed versus the total of the contract versus what you have in front of you today. On the page 2 of the little handout that I gave you, the first page I believe you had in the package. The second page is a comparison of what we're currently getting with Mend Correctional, what the proposal was kind of based on, and what we landed on. Now, a lot of stuff, what I spent a lot of time doing, just to kind of give you a little bit of idea. It's been a long time since I've been in front of the board, so making sure that you all understand what I was doing in this period of time. Part of negotiating the contract, because obviously not everything is in that contract that is possibly going to be provided. So a lot of the time between January and now was us making sure of the services that we're going to be receiving. How are we going to receive the services? What kinds of things are in there? What kinds of things aren't in there? What are they willing to do? What aren't they willing to do? Because all the day-to-day operation stuff is not in the contract. So a lot of this was making sure that we talk. Obviously, Greg Kreiser has reviewed this. Tim Dahl has reviewed this. We had some negotiation back and forth with some of the legal language that's in there. Their initial proposal or an initial time and the contract that they sent to me was actually quite a bit higher. We've negotiated it down to this point where they believe that this is the services and the time amounts that we need. They base their nursing coverage, provider coverage, mental health coverage on their community care piece. So based on what they would supply the same number of peoples in the community for types of resources, that's how they base their nursing hours and all of the provider hours and all of the mental health hours. If you look at that second page, down at the very bottom, the very last line, takes the whole cost of the contract divided by the number of hours that we're going to be provided, and it comes out to about $57 an hour, which in my opinion is a very reasonable amount of money for the services that we're getting. You also have to understand that we have a very high use population. I ran some numbers for another project I'm working on. About 50% of our inmates, about 2/3 of our inmates are here more than 15 days. All right, so our average length of stay is a number that's derived from every booking that we do, whether the person stays in custody and gets sentenced and has to spend a year in jail, or whether they're a book and release, Rule 5 booking who comes into the office for 30 minutes and we book them and wind up releasing them. So the average is based on that wide range of people. So the average comes to about a 14-day stay in jail. However, about 3/4 of the inmates in our population are there for more than 15 days. I can go run a number right now, how many guys and gals are in our custody that have been there for more than 15 days, and 3/4 of our population will pop up on that list. So that being said, that's when we're really starting to deal with people from a medical standpoint. Anything prior to that, we might be doing some things with, but they're really not here long enough for us to spend any real amount of time doing a lot of medical things with them. Well, of that 3/4 of the population, 50% of them or better are on some kind of a medication or regular reoccurring medical issue. So we have a very high use population. We talk about mental health a lot. That is something that we deal with quite a bit. We deal with a lot of alcohol, a lot of drugs, and then of course with those types of lifestyles comes a lot of other health problems, and then they start presenting when they're in jail. We get people off of the drugs, off of the alcohol, and realize that they have some problems and we have to start dealing with them. We work very closely with our medical to try to triage those things. You know, we know a person's going to be getting out in a couple of days. We'll help them set up some appointments and allow them to try to take care of that on their own rather than us doing it. A lot of times we're not able to do stuff like that anyways on short notice because, as you've probably known when you're making an appointment for your own doctor, it's taken on average probably about 3 weeks to get an appointment, you know, in any place. So we do a lot of stuff. We're trying. We have a lot of, there's not a lot of options for medical care in jails out there. Quite honestly, if this doesn't pass, we're going to just stay doing what we're doing. The Centric Care allows us some opportunities. We have the support of Health and Human Services. We have the support of I think, a lot of different employees in the county that deal with our inmates. This allows us some opportunities for continuing care that we have never been able to have, and that a company like Men, not trying to beat them down, they just don't have the ability to do some of the things that Centric Care is going to be able to help us do. This is a big deal for us, and it's hard for me to stand here and explain to you how big of a deal this is if you're not in there dealing with these things every single day. Currently, the company we're working with, our local nurses that work with us are fantastic, but the company has got some things going on with it that you have probably seen in the media. We deal with that on a daily basis. Of course, with that reputation comes people's idea and opportunity to exploit those problems. So this is a very important contract for us. I do realize, and I'm not taking away from the fact that I know that it's going to be more expensive to the county, but I think that in the long run, it will actually save us money and because of the reduced liability. Centric Care has they have a horse in this race. They're in our community. They have a reputation to protect. They have a population to serve, and this population is part of that population. So, any questions? Yes.
Captain,
You don't need to raise your hand.
well,
I mean,
I want you to
you're the chair.
Yes.
Somebody want to call on Christine, please?
So, medical director for MEND, it was 6 hours per week, and Centric Care is proposing 20 hours per week.
Yes.
I mean, that obviously adds to the cost, and wondering what the rationale is for that.
So one of the things that we've been seeing happen within our own facility is the lack of amount of time that a provider spends here with the number of inmates that we're dealing with. And we get a lot of file reviews rather than actual face-to-face time between our providers and our inmates. So this will, do I know if this is the right number or too much or too little? No, I don't. I do know that the 6 hours is not enough, is what I can tell you. And that's where, when we sit down later on and talk, if 20 hours is too many, then we'll cut that back. But I do know that 6 hours is not enough. We are constantly talking to our nurses about just how come we're just doing a file review rather than, by the time that the inmate is put on a list to see a provider, in my opinion, that means that the provider needs to actually see them. The nurses should have done, RN should have done the file review and made any recommendations. And these are things that these are inmates that need to be actually face-to-face seen at this point in time rather than just another file review done.
And the RNs make that determination?
The RNs triage all the people, review the files initially. If those are things that they can manage, they'll request that from our provider, and then we know that the provider's coming in once a week, and so they'll have a list of inmates that need to be seen. And sometimes our providers just don't have enough time. They're not here long enough, so they're just doing file reviews as well.
Madam Chair.
Line and then veg.
So the medical director is a doctor or a
The medical,
assistant?
the director is a doctor,
Is it?
yes.
Okay.
And then everybody works underneath that doctor's license.
Okay, so we're going to have a doctor there
Yes.
quite a bit more than we have
Yes.
currently. Okay.
And we monitor all those hours, and also in the contract, if for some reason, so Stearns County is the next equivalent jail to us that Centric Care is currently in. And in talking with them, they are very happy with the amount of time that they're getting from Centric Care within their contracts. It's very similar to ours. but not exact, but it's very similar to ours, or this contract. And he says that most times they're getting more time. They'll be there they'll be there longer than what they've contracted for. But again, that's the piece that they're vested in this, you know.
So 150 residents in the jail,
Currently, yep.
are those all our,
No, not all ours.
okay,
Some of
so will we get reimbursed then?
Well, that's part of our boarding fee.
Is it? Okay.
Yeah, that is part of our boarding fee.
Okay. So we need to raise our boarding fee.
It's possible. We'll have to reevaluate that.
Madam Chair, so, and I appreciate Sheriff Derringer and Mr. O'Malley, you bringing this forward, and the reduced liability is huge on it, but there's also the thing you have to ask yourself philosophically, do we believe in rehabilitation? Because if we believe in rehabilitation, we have to treat people physically first before we can treat them even mentally or socially. And by having the coordinated care piece to this, that a lot of these people never got in their life because outside of jail, they don't go and seek specialists. They don't get the palliative care that they need. So, I mean.
You're absolutely correct, Commissioner.
And that's
This discussion could expand into all kinds of different directions. But to take what you're saying, that's a piece that we do believe in. So do I believe that every single person who comes into jail is going to rehabilitate? No, I don't believe that. But I do believe there are definitely people within our jail and within the criminal justice system who can make that change or want to make that change. The medical piece, the continuing care piece, the MAT programs, all of these other things are huge in making that happen. Reducing, and if we can do that, we would also not just keep them from coming back to jail, but we reduce the number of contacts that our patrol division has with them. We reduce the number of contacts that our human services has with them. So I mean, this is a much, much, much larger discussion than just simply jail medical.
If you rehabilitate 1 in 4, I mean, the impact across the board from, like you said, from the contact with officers to damage in your community, this investment is small when you think about it from the holistic perspective.
Correct.
Madam Chair, I mean, when you first started talking, you talked about the mental health issues that the majority of the jail people.
They experience in some way, shape, or form. I mean, we have from simple depression all the way up to serious and persistent.
Yeah, so with the current system, we only have 8 hours a week of mental health services. Now we're tripling that, quadrupling that, having 24 hours per week, which that alone is going to be huge.
Yep.
Getting the mental health services to those people that need it.
And we internally within the jail, we've had Jill working with us from Health and Human Services. She's been over there, and we've got her for 20 hours a week. And I've always made it known to the board that at some point in time, I'd like to have her in there full time, 8 hours a day, 5 days a week. This piece with what she's already doing for us opens a whole lot of doors for our reentry programs or our ability to work with individuals, to continue working with them once they're outside of the jail. Because obviously the jail can't follow up necessarily with people that are once they're released. But those connections through HHS, through Centricare, through everything else allows that to happen.
All right, any other questions?
Do we make?
We haven't made it.
No, I'll make a motion to accept the contract with Centricare.
All right, motion made by Commissioner
second.
Delyden, second by Commissioner Ketchmark. Any discussion?
No, just thanks, guys.
Thank you.
Pat and Sean for working
Really
on this and
appreciate it.
getting
You
it.
don't know how excited we are right now.
Great due
I
diligence.
know I express it so well, but
All right. All in favor?
Aye.
Opposed? Motion carries. Thank you.
thank you very much.
Thank you.
All right. Moving on to items for consideration. Administration for topics for discussion at the county board workshop on Tuesday.
Yes, thank you, Madam Chair. I tried to compile, the list of items that we felt needed to be discussed. Starting with Great River Regional Library, would like to provide an update of their activities from the last year. Also, we did have the study going at the Compost facility. I want to provide an update on that. I know Mr. Hevel has been working quite a bit on aggregate tax. Wanted to provide an update on that. Additionally, you may recall we had a claim out there regarding the fairgrounds. We'll need some direction from the board on how we want to move forward with that, just from a staff direction and funding standpoint. So any items you wish to add for the discussion? Before I say that, I should note we're trying to coordinate a meeting with the Midwest Medical Examiner. Was planned for this meeting. Unfortunately, they had a conflict, so we moved them to May.
Okay.
So.
Madam Chair?
Yes.
Can we add just an update on the new facilities?
Oh, yeah.
Any issues or problems that we're having or miracles that have occurred?
It was really busy there yesterday. People were there. A lot of people down in DMV, and I mean, they're walking in, I need taxpayer services and this and that, so it's, yeah, they're busy. Anything else anyone wants to add?
No, the compost recycling facility assessment updates. I'm assuming then they'll let us know when they're planning on having, or are they gonna, is the engineering firm gonna meet with us?
I know they've put together some preliminary ideas.
Oh, they have, so they'll
Have
present
not.
those?
Yes, but will not have costs or anything. It was kind
No,
of
but
present
some
those at this
ideas
point.
anyway to move forward.
Good.
Okay, good. I was just kinda curious on where we were at with that.
Sure.
All right. Everyone good with that?
Yep.
Okay. Moving on to committee minutes. Mr. Delight broadband.
Thank you, Madam Chair. Broadband Committee met on March 28th. I'll make a motion to approve. No.
I don't, you had lengthy discussions, didn't you?
Yes, we did. We had Alicia Harrington on from Flaherty and Hood regarding the franchise agreements. That's still being worked on. And just for everybody, the franchise agreements is so that everybody's going to be on the same playing field. It'll be required for them to sign in order to get any money through the ARP program on the broadband money we've set aside. Hopefully, they'll all agree to it, so that way everybody's going to be on the same playing field through cities and townships. Whether or not they will remains to be seen. So hopefully that will work with us, that they will work with us in the future. She also talked about some of the broadband border-to-border grants and all that sort of stuff, and to see when those are going to be opening and how we can use those in conjunction with the county dollars that we've kind of set aside. It's going to be interesting to see how many applicants we get for those broadband grants that we're going to provide out there. Now, one of the things that I found very interesting was that the cable companies are the only ones. So if they're providing you TV services, they're the only ones that have to have a franchise agreement. If they're just providing computer hookup, broadband, then it isn't necessary.
Oh, you're kidding. But if they have TV and phone?
Yeah, if not, just TV, the way it sounded was just strictly TV.
Wow.
And maybe phone was part of it. That wasn't anything we really talked about because kind of the home phones are kind of going by the way of the dodo. It's like, have you ever seen, when was the last time you see a payphone?
Oh, wow.
I've seen an article in the paper or a cartoon where there was a picture of a payphone and young kids saying, looking back at the antiques that we used. So anyway, hopefully that will all work out for the advantage. Derek, do you have anything to add regarding that one?
No, the franchise one, I have more to say on the other one, but the franchise, moving forward with kind of bringing that universal one together for the little bit that it pertains to, for however long it pertains.
Which one do you have more to add to?
The RFIs,
Okay, well, I'll continue this and then I'll let you take over that part. County-owned infrastructure recommendations. Well, this is, we're trying to figure out what's the best way. What we had thought about putting in a loop around the county to the parks and the outlying shops ended up being a wee bit more expensive than what we originally had thought.
well, the cost benefit analysis just wasn't there.
Yeah.
Um,
Originally,
we
it was going to be worth it, but not anymore.
Now, the utilization would be too low because there'd be duplication of putting fiber next to areas where fiber already is, and then it just, the utilization would drop it down too much that it wouldn't be worth the investment.
So that's kind of out the window, and they're looking at trying to figure out how to move forward with that in the future. And a lot of it's going to be whether or not the ISPs, the cable companies, how much they're willing to work with the county to try and solve the issues that the townships and some of the cities, and even some in the cities and their outlying areas are having. So hopefully they will do the right thing in the future and work from there. And again, a lot of it talked about regarding the updated border grants and the grants from the federals, that eventually they'll figure out how they're going to service those. So they've got money aside, but nobody can get it because they don't know how they're going to figure out how to do it yet.
Well, I'm sorry.
Go ahead.
So border grants should come live here, within the next 30 days, hopefully.
Again, hopefully. How long has the border grants been out there?
Yeah, but the funding allocation, the application is hopefully going to go live relatively soon. With that being said, we'll have an idea of what areas may or may not get funding in Wright County. In conjunction with that, we directed staff to come back with 2 RFIs, one for fixed wireless and one for traditional fiber, that we will review those RFIs based on some mapping that we got through the feasibility study, and looking to see what comes back from our ISP providers with these RFIs, to see what the costs would be. And with that information, we can hopefully maybe enter into maybe some possible grant opportunities that will kind of, personally, I'm hoping that we can use as more of a gap funding pieces for those areas that didn't get the funds from the border grants, but then still being able to get that next notch down that just didn't have the utilization or didn't score well enough for that, but we can still get those areas serviced. That's where it's really interesting on the fixed wireless side. If we can get the speeds to meet the requirements, that might be some of our best utilization. So,
You want to, for the public, let people know what an RFI is?
request for information.
And the ISPs that I talked about are internet service providers, so there's so many different little things out here.
So more to come on our April meeting. We're just kind of moving the ball forward in terms of wanting to roll out some more grants, but kind of seeing how things are moving with our first set of grants, and seeing what the state and feds do with their funds.
Yeah, and they move fast, so we're expecting to have all the answers in April.
Well,
I lie.
You got 21 days.
I'll make a motion to approve the recommendations and the minutes.
I'll second it.
Okay, motion made by Commissioner Delight, seconded by Commissioner Betch. Any discussion? I do just have, pretty told Liz, but on the second paragraph, the second, with a 1, 2, 3, 4, 5th line down, said Harrington, you need a said there. Just a little tweak, but it does.
I think John did these notes.
Oh, did he?
Yeah, so I don't think we can blame him.
All right. Any other discussion?
To throw you on the bus, John?
All right.
Hearing none, all in favor?
Aye.
Aye.
Well, I have a lot of proofreaders in my work, so I completely understand. It's really easy to miss words.
And when I read, sometimes I just add those words in automatically
Well,
because I
you
know what
do.
you're saying.
You do, and that's exactly the problem. When you know it's supposed to be there, you think it's there.
Yeah, so it's there.
All right. Do we vote? No, I started talking.
Yeah, we did not
vote.
vote.
All in favor?
Aye.
Thank you. All right. Advisory Committee, Advisory Board updates. Who would like to start? Mr. Ketchmark?
Sure, thank you. ESB, Emergency Services Board, met. Probably the biggest thing of interest is the encryption process with the radios that are used in law enforcement and fire departments, and how they're gonna adjust the technology if it's there, figure out which radios have it, which ones don't. I've talked about it before, and it's moving very slow. There's gonna be a meeting in May to talk about it further, but if you wanna run criminal histories and data that's otherwise private about people, you have to be concerned about who's got access to that on the radios. And you don't wanna alienate your partners, because you have to talk to ambulance and fire departments, but you have to have certain channels that you can talk with them, but that they're not gonna hear this private data. So that discussion continues, and it's gonna come at a great cost, it sounds like, per radio even. And if the radios aren't compatible, then where are you gonna get the money for brand new radios? So that was the biggest discussion at that one. Next one was Minnesota Rural Counties met yesterday. Broadband they touched on, but other board members gave an update that's real similar. One thing that's of interest, sales tax on auto parts. There's a transportation bill that this is included in, about where's the money gonna go from sales tax of auto parts. Well, somebody's trying to push part of this bill through that would give up to 40% of this money to transit, Metro Transit in particular. So, and the consensus was that this seemed a little off, because you have your non-users of transit out buying auto parts, and the money from their purchases is gonna go to the non-users of transit to help sustain
Non-users
that.
of car
Right.
parts.
Right.
Yeah.
So, that one is in the works, and the consensus was in rural counties that they didn't, of course, because rural counties aren't utilizing transit very much, if at all. Another item that came up was the legislative interest that we had, emergency management grants. We're talking about those. The county-based purchasing, there was some discussion about that. SCORE grant, it's under a natural resource bill for the SCORE grant. They're looking at the solid waste tax and how that's dispersed. There's $100 million that's collected annually in solid waste tax, and there's proposal to figure out how more of that money could be given to counties, and that would amount to, if they get what they're looking for, an extra $18 million spread out to the counties. So that was of interest for that. There's a lot of money on the table with the solid waste tax and where that's going. And those were the highlights of those two meetings.
Glyden.
A whole lot going on last week. The Bertram Advisory Committee met on Friday. Just kind of an update on what's going on out at the Bertram Lake, that the campgrounds were 80%, I think, reserved for the summer.
Weekends filled up.
Weekends,
Yep.
that's what it was,
Yep.
weekends. I knew there was something that was pretty full, but it was, the way it sounded, it was filling in pretty good the rest of the weeks too.
It exceeded expectations.
And they've got, as part of the city part of the park out there, they have Minnesota State soccer tournament, I believe, or the districts or something going on out there, which they had last year. And that brings an incredible amount of people out there. So it'll be interesting to see how that goes. They're also trying to get some money, the city is, to expand their fields out there, just because the usage has grown dramatically. So they're going to be doing some blacktopping out there for an ADA trail to go from, we have a turnaround for people that are in wheelchairs and have issues with mobility, and that'll be blacktop from that turnaround, all the way down to the park area down by the lake. So that'll be a lot nicer for those residents that have a problem with mobility. Other than that, I think that was pretty much, those were the highlights. Derek, did I miss anything?
I think we're just talking about scoping out future building needs out there between the recreational nonprofits and football, soccer, lacrosse, baseball organizations, and the city and the county maintenance needs out there. Because it was addressed. Right now they're using an old shed that was out there from whenever, and that is quite small. And knowing that sometime in the next 2 to 5 years, they'll have to have some sort of a combined maintenance thing, and trying to decide what that funding would look like and how that would work with the nonprofits, because they want to have storage out there for their stuff as well.
Yeah, I remember the original drawing showed vending areas, and in those vending areas, they had storage for those nonprofits, and those would be in the same area that they'd be needing it, so I think that would work out good. So,
Well, I think that's what they're going to try and get a small group together and figure out where is it got to be two small buildings in two different parts. And,
I would think so, with as big as that park is, or as big as the sports facility area is.
Well, even just the passive park, because keeping the county equipment where the city is, they're both too vastly apart to keep them all in one spot.
Yep.
Or you could drive your mower for 20 minutes to get to where you need to mow.
Yeah.
I think that's pretty much about it.
All right, we got a nice letter yesterday from the Department of Human Services, Commissioner Jody Harpstead, that reported that it's her pleasure to commend you and your staff for perfect performance in meeting Department of Human Services financial reporting requirements for the calendar year 2021. All key quarterly financial reports for your programs in which the county participates were submitted to the Financial Operations Division on or before the report deadlines and in perfect order. So the effort required submission of 32 major reports covering the 4 calendar quarters of 2021. And then they list all the income maintenance, social services fund, Title 4E, brass-based grant fiscal, client statistics, and so local cooperative time studies. So just kudos to our staff who work diligently to make sure that everything is in order. But otherwise, yeah, I've had meetings with different people, but no advisory ones to report on. Commissioner Betch.
So we had some meetings, Bertram, we had meetings with, we got myself and Madam Chair got to meet our legal firm on Friday just to kind of get a feel of
Their services.
services, yep, that they can offer, so meet some other staff. Other than that, my first energy transition committee was postponed. So looking to hopefully sometime they're going to get that group rolling in late April is what I was told. There's a piece of legislation that we're hoping to get an amendment into this week into the transportation bill that would, if it would get included and get adopted, it would set a benchmark that counties with a population of over 130,000 would then, it would require DPS to maintain a full-time testing facility in those counties. So more to come on that. It's a big push to put it in from an amendment perspective, but
It's a start.
it's a start.
It may not happen the first time, it may happen the second time.
Yeah.
Question, is that, just to clarify, is that the behind the wheel testing or written testing?
That's the behind the wheel testing.
Oh.
Yep.
Okay.
So,
We got approved for 9 proctors here in Wright County for written, but.
Yeah, we've been getting ongoing resistance to this behind the wheel, so this would
Right.
be another angle per se to get
Yep.
that through.
because really now, right now it's at the full discretion. This would actually put some language in the statute that actually kind of forces the hand to meet population needs. So,
Yeah, good.
That would be great.
Did you meet, did you have a ditch meeting too?
oh yeah, my Ditch 33 meeting, yes, my, our Ditch 33 work group, I'm glad you brought that up. I met on Wednesday night.
I know the group.
Hey, we invited 40 and like 32, 33 showed up. It was a well-attended, lots of excitement that if we can move things forward to getting the system repaired, because for going on 50 plus years of neglect, that's been ran into barriers that we can't find a way to fix it, that this is a Hail Mary that we feel optimistic is going to do it. So.
Good.
Okay.
Wish you better.
Okay, I went to the Mississippi River St. Cloud One Watershed, One Plan Policy Committee. And they're kind of doing things backwards. First, we had a memorandum of agreement that we had looked over and made a few changes. We sent it to the lawyers, which met like a couple days beforehand. And all of a sudden now, the lawyers are saying, no, they're kind of divided between a memorandum of agreement and a joint powers agreement. And the memorandum of agreement would be that whoever would be the financial, do the finances anyways, they would be the one that could be liable for anything that would happen in any of the other counties. And so they kind of were divided between the two anyways. And then the joint powers agreement, that would mean that it would take off that liability off the finance, and each entity would have their own liability, have to handle that. That's right, Greg? And thankfully, Greg had talked to me, so I was the only one member present there that had actually talked to their lawyer that had attended that meeting. So kudos to you, Greg. And so now it's kind of up in the air what they're going to do. They all have to go back and talk, all the entities have to go back and talk to their lawyers and decide what to do. And they want to look actually at a joint powers agreement versus a memorandum of agreement and look that over. So they, anyways, it's when you work with a group that's
All different counties.
yeah. And then, so this will set the timeline way back so that they won't get money as soon as they want. See, we were actually supposed to be looking at a contractor already and stuff to do the plan, and so that's kind of all pushed back, so. And then, then yesterday, met with a few of the extension committee members, subcommittee, and we're working on picking a farm family of the year. So,
Oh, fun.
so that will be, by the end of April, we should have someone, I guess, so.
Question, so
Yeah.
on your One Watershed, One Plan, do they have a voting structure in place right now? Or, because if you go into a JPA, usually that's things that can dog things out forever, is in trying to create an equitable voting structure. Just
Who are the
curious.
voting members?
Yeah, who are the voting members, and does everybody get an equal vote? Is
Yeah.
it based on size? And that's just,
Yeah, we did have a little bit of problem with the Crow River, not the Crow River, I'm sorry, the Clearwater River watershed, because they have a representative from the watershed district, a representative from the SWCD, and a representative from the county, and they had thought that that could be one representation by one person, but having 3 votes, and we said, no, that's not possible, so.
Mary, with the one water plan, water plan, I mean, isn't the Clearwater Watershed District then supposed to go away in the future? Wasn't that the whole idea behind these one watershed, one plan?
Heck if I know, ask Bowser. They seem to know everything, because this is what's delaying it. We have to go back, once we have some of these things in place, then you gotta go to Bowser, and then Bowser will give the money to start the planning process, so.
A lot of
It's so involved with, and I don't know, maybe Greg can give a little bit more information. I know I was, oh, it's raining like cats and dogs
Because to
out
my
there.
best knowledge, it was set up to be a lot like our 7W districts are from like transportation and economic development. Chunks of money go to these one watershed, one plans. So right now, everything is going right through the state, and they're trying to delineate up into these regions, into these watersheds. And so your Clearwater River watershed will still exist, but now they're competing in a smaller pool than trying to compete at a state level. Right now, they're competing for these funds across the state, and it's really hard to direct money to certain areas. It's just trying to get some delineation and get some
I
money spread out.
wasn't in the beginning of the North Fork, but I mean, because they were a pilot group. But, because, you know, you're only allowed one member. I was there through the SWC. I wasn't there, but I mean, you know, we talked about in the SWCD, but I really didn't.
Yeah, I was always in the impression that this was to eliminate all that competition and just to deal with the watershed
That would be pretty
as
hard.
one.
No, it's that bundle of money that would still go out to the different projects, so.
Brian's rules of
Attorney
competition.
Kreiser.
I don't know if it,
Madam Chair, Commissioner Wetter, I think you summarized it quite well. The concern from our office mainly was that this entity is being set up as a joint powers entity. They're looking to have it operate as a joint powers entity. They want to have a board that votes, but at the end of the day, half the members don't want it to be a joint powers entity and rather just have us kind of be an informal group that meets and makes decisions, which, exactly, Commissioner Batch. So
Liability red flags
Yeah,
are going up left and
liability.
right.
that's exactly where our office, Sherburne County, and I want to say, is it Benton County? Lee? I forget. It starts with a B. Benton County.
Benton County
Benton
is the
County.
financial,
Yes, they were going to be that, Benton
Yeah,
County.
and Sherburne is the project
Yeah, the three attorneys,
facilitator.
our three offices on those counties said, this looks like a joint powers agreement, acts like a joint powers agreement, and it quacks like one. Let's make it one. Why are we going through this hassle of trying to get around this joint powers entity? When if we do it, MCA costs for insurance is $3,000 a year. The liability is taken off of everybody. Everyone gets a vote. You get a proper organizational structure, and you can actually get stuff done.
You make it sound way simpler than it ever plays out.
I know. Madam Chair, Commissioner Vetch, it's terrible when government tries to work efficiently. I get that. But I'm trying to make it happen.
And some joint powers agreements work really well. I mean, like the Central Minnesota EMS. I mean, we've got, they work really well, so you just got to get them in place.
Yes, Commissioner. Yep.
Anything else, Commissioner Wetter?
Nope, that was
All
it.
right. Thanks, Ray. Minister Kelly.
Well, thank you. Just a few normal meetings, of course, throughout the week. Last week, of course, we did transition all the departments from this location downtown to the new campus at 3650 Braddock, and everything was up and operational. So I appreciate everyone's patience as we were able to move. I think you'll find the new facility very nice and will serve well into the future. So outside of that, working through a few issues relative to the move still and packing a few boxes and getting things straightened out logistically, certainly. But doing a number of interviews for admin positions as well as next week, this coming week actually. Thursday, we'll be doing interviews for the Parks Administrator position. So that is all.
All right. And a reminder, we have, go ahead.
I was just going to say regarding the technology out at the new boardroom, that those parts came in, they're
Great.
doing the software on it now, and hopefully by the end of the month, we will be over in there in the new boardroom.
It'll be That'll be a nice.
Frank won't guarantee it. Man behind the curtain.
Be nice not to run back and forth, but, and a reminder, we do have leadership at 10:30. Is that in the Justice Center?
It is, yes.
In-
Justice
in
Center,
like 58 or 58?
86 and 87, which is in the basement,
Okay.
0 level.
Okay. And then we have transportation committee of the
Transportation.
whole at 12:30, so maybe we can squeeze in a sandwich between the meetings. We'll see. If there's-
I thought our county administrator was providing us lunch. Because he didn't give us much time in between stuff.
Whatever
Yeah,
it takes.
we'll see. There are, that marketplace sandwiches up in the 3rd floor, so maybe.
Oh, there is?
Yeah.
Oh, that is done, okay.
Yep, so-
Wasn't sure, good, thanks.
All right, if nothing else to come before the board, we are adjourned at 9:55. Thanks, everybody.